Maryland is poised to become the first state to cap certain prescription drug costs as a bill that would set up a 5-person drug affordability board heads to Governor Larry Hogan's desk. The state board would spend a year reviewing management of medication costs in other states and developing recommendations for Maryland's Legislative Policy Committee on how to reduce those costs. In a last-minute change, the Senate amended the bill to only apply to plans that provide coverage to county and state government employees, with consumers potentially feeling the earliest effects in 2021, top reports. State lawmakers passed the bill on Monday in the final hours before adjournment of the 2019 legislative session. Tammy Bresnahan, AARP Maryland's Associate State Director for Advocacy, commended the legislature. According to Top. The move puts Maryland at the forefront of states seeking to combat the high cost of pharmaceuticals, she said in a statement. The board to cap drug costs comes as the Trump administration, Congress and other states are trying to tackle the growing prescription drug cost dilemma. Prescription drug spending nationwide reached $333.4 billion in 2017, according to the National Health Expenditure data. Despite being one of the smallest states in the nation, Maryland was in the top 20 for total state health care spending in 2014, at $51.3 billion, a more than 60% increase from 2004, according to the Centers for Medicare and Medicaid data. Of the 55% of Americans who regularly take medications, more than a quarter reported difficulty affording their medications, according to a 2016 Kaiser Health News poll, accounting for about 14% of the total population. In 2014, the health spending per capita for the Old Line state was about $8,600, slightly higher than the national average of $8,045, according to data from the Centers for Medicare and Medicaid Services. The higher health costs have caused some to forego medications, which is unacceptable, Maryland Del. Joseline Penemelnik, D. Prince George's and Ann Arundel, told local radio station WAMU in January. It's ridiculous, said Penemelnik, who introduced the bill in the state's House of Delegates earlier this year. People should be able to afford their prescription, without giving up whether they're going to pay a bill, whether it's their mortgage, or whether it's their meal. A similar bill from 2017 failed in the state Supreme Court in 2018, when a judge ruled it unconstitutional, as it gave Maryland the power through Attorney General Brian E. Frosh to regulate commerce beyond its borders, according to The Washington Post. This year's bill creates a drug board including clinical experts and healthcare economists that would operate similarly to a public utilities board, the Post reports. A Health Affairs report out earlier this year found the annual cost of brand-name oral prescription drugs and injectable drugs rose year-over-year between 2008 and 2016 by 9% and more than 15%, respectively. The cost of insulin, a drug used commonly to moderate sugar levels in people with diabetes, alone doubled between 2012 and 2016, according to the Healthcare Cost Institute. Other significant bills made the cut on the Maryland legislative floor Monday evening, including laws that would raise minimum wage to $15, significantly boost funding for public schools, require the state's energy to move toward 50% from renewable sources and ban the use of foam packaging, another first for the U.S., according to the Baltimore Sun. Maryland's 439th legislative session ended a day after Speaker Mike Bush, who had been a leader in the state's House of Delegates for 16 years, passed away unexpectedly. Hogan and his presiding officers opted to delay the traditional bill signing on Tuesday in honor and out of respect for Bush and his family, top reports.